name is Vanya Ray, and I wanted to talk to you today about hip pain. Let's see once I get up if this is still where it's supposed to be. So I used some painter's tape in order to show you these are my hip bones, these are my abdominals, and these are my legs already, more or less on the same level. Doesn't quite matter. What I wanted it to be are kind of lines that you can see, so that you can see the hip rotation or the leg rotation underneath. So what very often happens is people who experience hip pain, when they walk, they don't walk just straight with calm hips. What they do is they rotate their hips a little bit. So they're very often not conscious of it, but the hip starts rotating, and it leads to this slight rotation of the foot whenever they start stepping. Actually, I'll need to lower the camera for you a little bit more. Good. Because you don't need to see my face so much. You definitely want to see my hips and my legs. So what that problem with the rotation of the hip is usually exacerbated by two things. One is which role I'm dancing more often. If I'm a follower and I have this position, more often than not, if I'm not careful, I have a little bit of a rotation of the hip toward the front. So followers more often than not have a problem with their left hip, while leaders, of course, have the same problem with the right hip. And the other, I said there are two things that exacerbate it. The second one is which hip I sit in. So people who sit in their left hip usually, they would have more of a problem because these muscles are weakened and they're overstretched a little bit. So they need to be more careful on that side. Let's say I have a problem on the left side. So what would naturally happen for me is that if I'm standing on my right leg, on my strong leg, and I'm moving off of it when I start taking a step, you can see that those two bottom points are hardly moving. The bottom points, my leg definitely not at all, and my hip is moving very, very little, and then my abdominals are moving more, and I'm taking a step. And whenever I start taking a step on the other side, on the weak side, you can see how all 3 points now rotated. Instead of what should have happened is for them to stay back here. But this is the natural type of rotation for a weaker side. So what we want to do is whenever I start transferring the weight from my stronger leg, where I'm right now, I want to imagine that I'm kind of holding my ribs in and tucking them in a little bit, and I'm allowing my free hip and my free leg to just kind of hang naturally down before I start transferring the weight. We're going to talk about the transferring the weight in a second, but what usually happens is that the weaker side, on the weaker side, the abdominals are more relaxed. That's why if you hold your belly or your the area between your ribs and your abdominals, you're probably going to feel that you can feel more of the ribs on the weaker side instead of on the strong side. And if you engage the abdominals, then you're going to feel that now all of this becomes symmetrical, and you can see how the moment I engage the muscles, my hip has a little bit of a rotation. I was not trying to rotate the hip. It's just because of the abdominals engaging. And then whenever I start transferring the weight afterwards, what I would naturally be doing on a weaker side is my weight is going to stay slightly to the front in my hip because of that rotation of the hip. So what I need to do is I'm going to imagine that somebody's pulling my hip back and slightly around while transferring the weight in order to get to that neutral position. So it's almost like I'm trying to kind of push very slightly back with my hips on the side, on the weaker side. So this is a stronger side. The world is fine here. I'm tucking in and I'm imagining, which side can you see it? And then I'm imagining that I'm being rotated and pulled back slightly on this side in order to arrive to a position where I can be stable. And I think that the 3 points should be fairly one under the other right now without any excessive rotation that you can see. From there, whenever I start stepping, I'm holding those points back as I'm taking the step. because this is what I would naturally be doing on the stronger side. I won't rotate it out. I don't even think about it, but I'm holding them back. And now when I start transferring the weight over the weaker leg, I have to have the sensation of rotation and pulling back and holding that position, rotate it and pull back so that it doesn't do what it's naturally used to doing. And that's it. You want to make sure that you're tucking in the abdominals, that you're holding them symmetrically. You can use your hands to feel that they're protruding at the same rate and not one more than the other. Lifting up the leg, and when you lift it up, soften the knee so that the hips can hang and you're not doing something like this, distorting the experiment. See how the hip just hangs. And after that, see when you're starting to transfer the weight, if you can pull back and around in order to get to a position of stability. See if that works for you. I hope it does. And that's it for today. Thank you for watching.